Okay, this is the Chapter 2 Safety and Wellness section. So, this is just a sort of definition for medicine. So, you just provide the knowledge that you're given to the actual pre-hospital setting and transportation. But it's important to note this is based on your assessment findings, which I think we're going to go over in Chapter 10 whenever we have that. For a patient who's acutely, which means it's not chronic usually, it's an acute setting, it's all at once, patients. So some of these competencies that you're going to have to know. So how to decon equipment, you're going to have to do that over or after every call. And that's the whole ambulance and all the equipment for the patient, including things like the seat belts that strap it in. So you need to apply the knowledge of the EMS system, which we went over in Chapter 1. Your own safety and well-being, the medical legal, which is the next chapter, and ethical issues. So you can actually provide this care. So this is the foundation for that stuff. Workforce safety and wellness is really important. So you need to always take standard precautions. We'll go over those there. Part of that is actually putting on your protective equipment, managing your own stress, because we deal with a lot of things like death and dying. And then prevention of injuries on the job, which happens all the time. So you got to watch those injuries, especially when you're lifting and moving patients. That's going to be Chapter 8. And then disease transmission. All right, so, you know, with wanting to be an EMT, you have increased risk of a lot of things compared to a lot of professions that may be out there that you could have chose. So things like infectious disease, because we transport patients that are sick and may have a disease that can spread to you. You should know that from just all this COVID stuff that we have, but also hepatitis C, HIV, those sorts of things. Violence is possible because a lot of the patients are on drugs or alcohol, or they're just violent people, domestic disputes, that sort of thing. So you're going to be called on to go to these scenes of tragedy and death, and then people who are sick and injured. Some of the threats and stressors that kind of will affect you here are going to be sleep fatigue, deprivation, the violence, like I said, PTSD, and higher rates of extra responder suicide. So you have to watch all those things. In EMS, you're both going to tell you something like 34-35% received an actual diagnosis from a mental health care provider of some sort of mental illness. This could be anything from suicidal ideation to depression, PTSD, any and all those things at once. Okay, so you really have to learn how to take care of yourself because even just threatening suicide, thinking about it, is much higher, and we don't actually know how high that percentage is because there's not a whole lot of studies done. The closest ones you're going to find are in places like Saudi Arabia. So, not really well documented, though. Everybody is sort of touched by this in MS. So you have to care for yourself. You have to recognize the hazards of this stuff. You can't neglect yourself, your sleep, your health in general, exercise, that sort of stuff. And then hope to be mentally well as well. So there's going to be a lot of mental stress and physical stress on the job. It is not like too demanding on your physical stress here, but things like back and shoulders can really get injured in this job. So your health is complex, like I said. It's physical and emotional, and you make these emotional connections with your partner and all the patients and their family just because you have empathy as a normal human being. So there's going to be sort of chronic problems over the long term that can develop just because all the stress on the job. All right, so it's mental fatigue a lot, and it increases the chance for developing various health conditions. Things like high blood pressure is common. Other things like kidney stones are also common. But you should know that not all stress reactions are negative. There's actually good stress. It's called eustress. For medical terminology, anything with the EU on it just means normal or good. That's a positive response. But distress can cause a negative stress response as well. Put it in a chart here. So if you don't have any stress at all on your job, you're going to have boredom. But if you have high stress on the job, you're going to have anxiety, depression, PTSD, those sorts of things. So you're going to try and actually aim for that area of eustress, which is actually where you perform the best on the job. So wellness is going to be an active pursuit. All right, so it's something that you're going to have to do. All right. Resilience of a person varies from person to person. So how well you can actually take stress varies depending on you. And there's a lot of things that go into it, but just make sure you do things like get at least 7 hours of sleep a night. That's going to go a long way. Make sure you have a good, strong relationship with your family and friends, because they're going to be your support system, not just in school, but while you're on the job. So, like I said, build your relationship with your friends and the people you actually work with. So make sure you try and incorporate things like physical activity, because it can really help relieve that stress when you have too much. And then build habits of a positive attitude and try and keep that. It's very hard here. Kind of be mindful of the job. So you should try to minimize or eliminate the stressors. When you go on your clinicals, you're going to notice that you're going to have a sudden burst of energy from that fight or flight response. So that's okay. Over the course of time, you can try and manage that as best you can so you don't get sort of tunnel vision there. That would be bad. Just focusing too much on one thing and not others. But you can always change your partners if you have to. Change your work hours, because some of these jobs are going to be like overnight shifts from 8 p.m. to 8 in the morning. That's kind of hard on people, especially when they have families. You can change your work environment, cut back on overtime. Some places are better for some people, not for others. So you might fit in one place that I wouldn't, and vice versa. Right. So try and change your attitude. Always have a positive attitude about this stuff. Try and view it as glass half full kind of thing. Don't be afraid to talk about your feelings, because people are there to listen. They know what you're going through. Trust me on that one. A lot of places that you will work will have professional counseling available to you. You can call on the phone, or you can find your own if you'd like. But don't obsess over frustrating situations. Don't make it your constant thought. So try and have a relaxed, philosophical outlook. So before you start this stuff, you got to come to grips with your views about life and death. And you have to think about that yourself and how it's going to affect your job. So always try and expand your support system as best you can and strengthen those relationships. One of the important things here is to not take the work home with you as much as possible. You don't need to bring that into your family life. So always have friends and interests that have nothing to do with medicine. That's going to be a big help to you, because anytime a bunch of EMTs get together, what they're going to want to talk about is the job. Also important is limiting your intake of stimulants and depressants. So listen there, caffeine, alcohol, tobacco, all that's true. All that's going to make the stress worse. So make sure you eat well. All right. It's going to say limit the consumption of sugars and stuff. Sodas are going to be a big thing. No sodium, alcohol, and make sure you drink your water, because you're going to be really prone to dehydration on the job, especially in these horrible summers. Another thing is that you're going to be prone to actually kidney stones if you work in a busy environment, because you're not able to go to the bathroom a lot, so you can get urinary tract infections and kidney infections and things like that as well. So if you drink a lot of sodas and coffee and anything, you can get kidney stones too. So make sure you have regular exercise. It's good for your mental health as well. So try and engage in about 30 minutes of activity, at least five times a week. So try and get 7 to 9 hours. That's going to be for an adult. That's how much you're going to need. It's going to be hard even in school, because I know a lot of you are working right now and come to school, so I know it's difficult. But, half of EMS people get less than 6 hours of sleep. It has to do with a lot of things, including the shift work, just inherent in the job, and then not managing stress well. So try and get your 7 to 9 hours, so you can have, or be more prone to mental and physical problems. All right. So the evidence-based guidelines, which means that it's been scientifically studied for fatigue management, was developed under the Department of Transportation, which, as you learned earlier, does kind of make our curriculum here. And then your state office is the EMS, so they kind of know what they're talking about. Make sure you get your 79 hours. So, recommendations to, combat against this fatigue, okay, that you're going to get, because it's 12-hour shifts in busy systems. You're going to be running from the first call to the last throughout the entire time. So make sure you get good quality sleep. If possible, try and take a nap. Increase your physical activity because it helps with anxiety and kind of burning off that nervous energy. And be careful about your caffeine consumption. Don't be drinking coffee throughout the shifts, that sort of stuff. And engage in mental exercise, which is going to be important throughout the entire call and the entire shift. So try and keep yourself mentally active, but not so much that it's going to cause mental fatigue for you. So avoid caffeine, nicotine 4 hours before sleep so you can actually get to sleep. Make sure it's a dark place that you're sleeping. That's going to be harder around shift, and you're working a night shift, and you come home in daytime, and you're supposed to be sleeping. So exercise early, and allow enough time to relax after the exercise, which is going to be important. And then heavy meals before sleep, obviously, and make sure you're drinking plenty of water. So have a routine for your sleep. Make sure it's calm, whatever you have to do that. I know it's harder, especially if you have young kids, but sleep when you're tired. All right. Don't watch the clock. Make sure your sleep schedule is consistent throughout the week. Like I said, if you're working overnight shifts and the weekend comes, people are going to want to do things with you, and then it's going to mess up your sleep schedule. It's going to take you a lot longer to get back on the right schedule, and you're going to have less than that 7 to 9 hours a night. So exposing yourself to natural light, which is why they want a sort of dark environment, messes with your circadian rhythm here. All right. Disease prevention focuses on care before you get something and it avoids it. We talked about that in the first chapter. So, health promotion, focus on the practices and things, either personal or within a society. You can even call it within an EMS society that improves one's health. Nicotine's bad for you. I think you should all know that. It destroys your lungs, but there are strategies available for helping you quit. If you're addicted to nicotine products, so that's just smoking, vaping, even smokeless tobacco, that sort of stuff. So there is an Oklahoma helpline. There are billboards all over. So alcohol abuse is very common throughout EMS, especially when you have things like PTSD, because people try and cope and they don't do it in healthy ways. And they start drinking alcohol to excess. And that's the problem, the to excess thing. But acceptable consumption is, basically a drink a day for women and 2 for men. So that's not a lot. It's not a lot, but excessive alcohol can really harm you, causes all sorts of liver problems, and your risk for developing cancers. This includes things like binge drinking. So you may think that you kind of have it under control, but if, after work or on the weekends when you're off, you drink to excess and then have these long periods of sobriety, that's still not good. You need to make it so that it's kind of consistent throughout. Drug use is bad. We're talking about illegal drug use here, but there are prescription meds that maybe people can abuse. You have to watch that stuff. It's really going to affect your work on the job. And if you get caught using drugs that you're not permitted or prescribed, you're going to lose your job. You're going to lose your license. So a lot of the EMS companies, I think most of them that I ever worked for, have tested for drugs at the start of my employment. And usually they'll have, if they have a good reason to, they'll test you while you're there. All right, so work balance. All right, so you can rotate your schedule, get yourself time off. Don't forget to take vacations, spend time with your family. And then when the stress becomes too much, make sure you seek help the best way that you know how. That includes those mental health counselors, talking to your family. That doesn't mean giving away private information about patients, but talking about how you feel, that sort of thing. Talk to your coworkers, too. They're always a good source. Infectious disease here. So infectious disease is caused by organisms within your body. So that's what infectious disease is. But if that disease is actually going to be communicable, that means it spreads. So infectious disease is within your body where the bacteria or the virus grows. Communicable disease is one that can actually spread from person to person or even from, one species to another. Think malaria, it's caused by mosquitoes, that sort of thing. That's what they're talking about. So infection risk can be minimized. Okay. So you need to wear your personal protective equipment, what we'll call PPE. All right. Get your immunizations, and hand washing is a big one. All right. So make sure, even if you're wearing gloves after a call, best you can, wash your hands. In every room in a hospital, there's going to be a sink stall. So go ahead and do that when the call's over. You're done giving your report, and they're taking care of the patient. You can wash your hands there afterwards. So a pathogen, all right, it's just going to be like a disease. So like the HIV virus is a pathogen. You could have staph infections. That's a bacteria. It could also be things like parasites. So either amoebas or worms, that sort of stuff. There's several others that aren't listed in your book that's not quite as common. But if these pathogens are bloodborne, that means it can actually get you infected from their bodily fluids. So in those cases, you want to wear things like face shields, that sort of stuff. And there's several ways to actually get these pathogens. Okay, so you can have indirect contact, which is basically it comes from the patient to the other person, but there's an object that actually the other person gets it from. So if you don't clean the cot correctly, someone else can actually get that pathogen because you didn't clean it correctly. The actual, like infectious diseases that are most common to have this happen is going to be hepatitis B and hepatitis C. So you can get the immunization for hepatitis B. I got mine from the health department when we started. That's probably one of the ones that you had to have anyway. So you don't have to have direct contact, which is from one person to the other. You can actually have indirect contact. So by way of something else. Now, the thing that actually the object that causes indirect infection has a actual technical term. It's called a fomite. So that's in your book there, I think. So watch for questions like that. I know it's not bolded, but it is something that you're going to have to know. So there's several ways that these things can actually be transmitted. Like we talked about with direct and indirect contact, it can be by contact, which is just from one organism to another or one person to another, either one. Transmission can be actually from animals, or like we said before when we talked about malaria, it's from mosquitoes, or actually the plague, which some people do still get. They get it from typically handling dead animals that have fleas on them. The fleas are the vector, the animal species that's different from you that actually gives you the disease. So people still do get the plagues, usually children, that sort of stuff. It can be transmitted by airborne. So that's going to be droplets or dust. It's typically from people coughing or sneezing. All right. So if the actual droplets are tiny enough, they're turned into airborne particles that can actually stay in the air for a long time. So you probably know this just from the coronavirus. But because of airborne transmission, it's usually unsanitary to use your hands or a tissue to actually sneeze into. Okay, so what you need to do is actually, and they'll have signs about this in an emergency department waiting room, is actually put your face in the crook of your elbow there, and that's usually how it's done. Now, there's a couple other terminology things that you need to know here. So, pathogens, that's just, like I said, it's whatever microorganism is transmitting this infection. And it can be several things. Like I said, bacteria and viruses are the most common. Contamination, okay, is basically, it's that pathogen or foreign body on an object. So if you transport a trauma call and the blood pressure cuff that you use is actually covered in blood and you put it on someone else, there'll be transmission from you. All right. Now you can get exposure as well, but that's kind of, if there's a situation that a person contacts the blood and bodily fluids or even the airborne particles, okay, it can allow the transmission to occur, and that's exposure. If someone sneezes in your face with happens sometimes, or coughs in your face. I've gotten sick from patients doing that to me before because we didn't wear masks all the time. So that sort of thing can happen. Now, I think I told you what PPE was before. It's also called BSI, body, like substance isolation. It's just the protective equipment. So that can include, gloves, face shields, masks, actual gowns, disposable gowns that you wear so it doesn't get on your clothes and you don't actually cause like indirect contact from your clothes to another patient's. Those are some of the things you need to know. And so, like I said, there is direct contact. These bloodborne pathogens, you can also get it from needle sticks. So if you actually poke the patient with the needle and then poke yourself, you can get that. That's commonly like more serious than indirect contact stuff, which is going to be like needle sticks depending on that object. But you can actually get blood in your face in trauma calls and things. People get blood in their mouth and then they start coughing and it can get on your face. That sort of thing is very common. And then, like I said, airborne transmission. You can have foodborne stuff too. That's usually like going to give you like the stomach flu, that sort of stuff. And then vector-borne, which, like I said, is going to be things like malaria and. All right. So all EMTs are trained in handling bloodborne pathogens. I think you should have gone over the video already that teaches about this. But the CDC, which is the Centers for Disease Control, they have standard precautions. Number one is going to be hand hygiene. So if you work in a hospital, all right, you're going to be told that you need to wash your hands when you come into a room and then when you leave the room. So a lot of hand washing. And then there's going to be this PPE stuff, the personal protective equipment, gloves, gown, mask, just like I said. So I guess you need to know donning and doffing, putting on and taking off. All right, that's kind of easy. You don gloves, you put them on, but you need to know the right way to do it, and to make sure that after you put on your gloves, you're not touching your face or your hair and that sort of stuff, because that does risk contamination. So proper hand hygiene, hand washing. This is always a question, by the way. So you'll need to know this. Hand washing is the simplest but most effective way to control disease transmission. So these kind of questions do come up, and the answer is usually hand washing. So like I said, before and after patient contacts, even if you wear gloves. If there's no running water, like in an ambulance, sometimes you won't transport somebody, but you'll treat them on the scene. You should have some sort of waterless, like hand washing substitute there in the ambulance. They should do that to you. You're always going to wear gloves, so always wear gloves. Even if you're cleaning, wear gloves. All right, they're made out of several things. The vinyl are the worst. Nitrile are okay. They'll usually never let you wear latex gloves because so many people are allergic to it. But there are some situations like OB calls. You have sterile gloves in there, which are actually sterilized. They're not regular gloves from a box. A lot of times those are going to be latex, actually. So you need to ask the patient about allergies to latex before you don that sort of stuff. It just keeps it so that you don't transmit things more easily to a baby that doesn't have a really developed immune system. So removing gloves, the basic point is, you don't touch your skin with the glove. So you kind of halfway take off one glove and then use that halfway taken off glove to actually take off the other. It is shown in your book here, and we'll go over it in the lab if you need to know. Face shields. Protect your eyes. If there's anything that you're going to do where you're going to be around a patient's mouth, you need to go ahead and wear eye protection. Most of the time, glasses are acceptable if you're okay with only wearing those, but they should provide you with eye protection wherever you work. That's kind of a requirement. Now, it's going to tell you in your book, and they're absolutely right, prescription glasses aren't adequate, but some places will actually just let you wear those. I would suggest that you actually get some sort of goggles that you wear. All right. It's usually going to be, not quite goggles, but sort of actually just clear sunglasses kind of thing. So, as I said before, gowns, protect your clothing and your skin from splatter. Skin is actually a really good barrier against disease, so long as things like your cuticles are taken care of and you don't have much scratches or abrasions. But it's best not to actually tempt that. So wear a gown when you need to. The most common one you'll probably run into is going to be obstetric calls, ladies in labor, that sort of thing. So anything that has aerosol generating procedures, which is going to be things like if someone actually has COVID, it's a good idea to actually wear the gown because there's so much aerosolized, like in the air, just from the droplet problem, that a lot of places will have you wear a gown. And like I said, deliver a baby, and then major trauma, things like gunshot wounds, shot to the head, that sort of stuff, where a lot of blood can be present. It can be a good idea to actually wear a gown on the call. And I'm also going to suggest to you that if you go on your clinicals and you're able to actually afford it, go ahead and buy an extra shirt and an extra pair of pants, just in case something like this happens. Masks and respirators, we wear these a lot of times now just if we have a known COVID patient. The other reason would be if someone that we think or we know has tuberculosis, we're wearing N95. It's usually a low situation that you're going to actually have somebody that has tuberculosis, that you're going to be with them long enough to actually get the disease. But it's a good idea to wear a respirator. Now, the patients, you're going to put them on a regular surgical mask because it's not necessary that they wear the N95 and you wear it. And it's really uncomfortable, especially because these people a lot of times have breathing problems. So the patient's going to wear the surgical mask. So, by the way, these N95s, I would tend away if you're actually buying one from those N95s that have the valves on the front. Use the ones that are all closed. That's usually your best bet. These barrier devices, like pocket masks, you don't technically have to give it. We went over in CPR how you can actually just do like compressions only CPR on people that you don't know. So, and it actually works. If you have like a BDM like we showed you, it's better if you have another partner there. You can actually use that. But if you want to carry a barrier device in your car, and that's something different. When you're on your clinicals, there's always going to be enough stuff. They don't want you using this stuff. So you can use the pocket mask, but the BVM is going to be better, which is a bag mask device is what they're talking about here. But these are all disposable. Do not reuse these. All right. In those barrier devices, you can actually get different filters and things to change those out with each person that you use them on. They're not too expensive. So you have to actually properly dispose of sharps in a sharp container. You will use some sharps because you're going to be doing things like checking blood sugar. So you have to poke someone's finger to actually get their blood sugar. So that's one sharp that you'll actually use. But if you're working with a paramedic, a lot of times there's going to be IV sharps and things. There should be some sort of safety device on it. But if it's a sharp, always treat it like it can actually stick you. So be careful with that. Don't try and recap or bend needles. A lot of people do that. Dispose of it in an actual sharp container, and they'll give you several of these. So, it's absolutely true that it's not risk-free to be an EMS. So, you do have a certain amount of risk, but you can actually try and limit that exposure risk by doing things like wearing the proper PPE. OSHA is going to be the ones that govern the safety of the job. So know your department's infection control plans. Typically, they're going to be in your protocols and follow those. So infection control, every ambulance service has to have an infection control plan, and it should be part of your daily routine, including things like cleaning the truck, the inside very well. So there's nothing more disgusting than walking in a truck and having red blood and things around there. So make sure you clean everything well. Look at everything, the rails on the cot, that sort of stuff, the seat belts, the actual equipment you put on the patient. Right? So you have to clean those after every run, and usually at the start of the shift. So it should be done at the hospital when possible, so you'll carry cleaning supplies on the truck. But sometimes it's so bad that you might have to go back to the station because there's a lot of mud. You're going to have to mop and that sort of stuff. Sometimes that happens. But if you can, clean it in the hospital so you can actually stay in service as long as possible. All right, immunity. There are several types, and I don't think they go over them in the book. Mostly, they're just talking about your natural immunity, and then sometimes vaccines here. So if you have immunity, even if the germs get to you, your own natural defenses can actually fight off whatever infection, the virus or bacteria, what have you. So you can be immune, especially if you've had that disease before. A lot of times, you're going to build up a natural immunity. So one of the things, though, is make sure that you have a good personal health, because if you're under a lot of stress, your immunity system just plummets and you're going to get sick more. Right? Make sure you get all the immunizations, and you're required to anyway. So you'll notice here in your book, the actual CDC recommendations are kind of the ones that you all have to get. So if you're exposed to blood or body fluids, say if you're taking care of the patient at the time, you need to inform your partner, and as best as you can, have them switch roles with you if you're being the primary caretaker, so you can actually take care of this, whether or not you have to wash it off, or if it gets in your eyes, if you have to flush your eyes, that sort of stuff. But to flush your eyes, you actually have to do that over 20 minutes. So you either have to use an eye wash, or there's actual lenses you put in your eyes that they run fluid through for 20 minutes straight. So whatever the situation is, just use your services infection control plan, and then you have to complete an exposure report. Because some of these things, you're going to be required to take medicine if there's a high chance that you can actually get a disease from these people that prevent things like viruses from actually affecting you as much. And then those can help you not actually get the disease. Scene safety, always protect yourself. That's the first step. So the scene safety starts as soon as you get the call. All right, so make sure that things like suicide attempts or car wrecks or any sort of trauma like shooting, stabbings, you got to make sure that you have police there, fire department there. You're going to need a lot of protection stuff. Okay, so protect yourself once on the scene as well. So watch out. Don't get that tunnel vision that I'm talking about. Make sure that you can actually protect yourself, and if necessary, watch your partner's back too at the same time. Okay, hazardous materials. So this thing on the right here, the emergency response guidebook, is usually just called the Orange Book. If you actually thumb through this thing, and every ambulance in Oklahoma is required to have one of these, it's a pretty thick book, but there are several sections, and all of them are just ways to looking up these placards and things in a different way that you can. But trying to identify what you can from a distance with these placards. The white's going to be health, red's fire, that sort of stuff for activities on there as well. So don't enter unless it's safe to do so. The hazmat people are generally going to be your fire departments. They're the ones that are going to be experts in this, and they've taken extra classes for this. So if there's any sort of question about what's being carried, they're going to know. Okay. Watch out for electricity, especially down power lines. Those are the big ones on wrecks. You got to watch for those. All right, so you always make sure that if there's a down power line, you don't go near it. You don't walk onto the scene until basically in Oklahoma, OG&E is usually the biggest one saying that is safe to enter. And again, the fire department has their number, and they contact OG&E for you. So you may need to mark off the danger zone, and that's okay. So lightning strikes, repeated strikes can occur. People have been struck by lightning more than once and actually lived. But it's either from a direct hit from the lightning or it actually travels across the ground. So the basic suggestion is you get as small as you can, like by sitting on your feet as low as you can, and that only gives the 2 points of contact with the ground, and then you're kind of grounded there, and that's your best chance. And lightning strikes, usually people describe a tingling feeling, their hair stands on end, that sort of stuff. In your book, it describes a lot of things that you can do. Things like try and get into the car. I'm going to tell you that I don't know about you, but lightning's faster than me, so I'll probably just get down on the ground. Fires. Fire hazards are big. Even if you're just on an ambulance, you'll respond to these because the fire department's in those big bunker gears. Even if it's winter, they're in a fire. So they're going to get dehydrated and sweaty, so you got to watch out for them. And then you have to wait and see if they actually find someone on scene that you're going to need to take care of. But the hazards on the fire, they include smoke. Okay, this smoke actually is toxic gases a lot of times. When things like plastics burn, toxic substances like cyanide can be released, which is why if you're running a call with, say, Oklahoma City Fire Department, they actually have the cyano kits there, which is the cyanide poisoning kits, because cyanide's one of the big ones on the toxic substances that get released. A lot of firefighters over the years, especially the older ones, from decades ago that didn't wear a lot of respirators and stuff when they're outside the fire. There are cancers and things that they develop, but as far as the hazards go, you also get things like oxygen deficiency because the fire will actually use the oxygen. The high temperatures, obviously, fire burns you. You should know that. And then building collapse because it kind of messes with the structures of the building. So always use proper protection. Vehicle crashes. Yeah, very common. The one thing that you really have to watch out for is going to be the traffic. So there are certain things you can do, and we'll go over this in ops. But typically what's going to happen is the fire department's engine is going to block the lane because it's a bigger truck. It's harder to move even when hit at high speeds. And then it's going to come the ambulance or the police department vehicles. Okay, and that's usually how it goes. But watch for traffic when you're exiting. You know, the driver, the ambulance usually gets out with traffic, so they really have to watch that and make sure they're pulled over far enough as far as they can be. Stay on scene as little time as possible. Now, when you approach the vehicles, these things can be unstable. The fire department is the ones that are actually going to have equipment to actually stabilize these things. They actually kind of look like little Lego pieces they can put on there. They have an actual name, though. But also watch for those down power lines, like I said, any sharp objects. If the fire department actually cuts the patient out of a car, so they will cut what's called the A-post, B-post, whatever, and takes the roof off. Any of this twisted metal, either from the wreck or from the fire department actually cutting the patient out, will cut you. And I don't mean like a nice little superficial cut. I mean to the bone, which is why the fire department wears all that bunker gear when they're doing this stuff, is for sparks. The sharp metal and glass, all that kind of stuff will cut you. So, some ambulance services, especially if you're in a rural area, may actually give you bunker jackets to wear, especially if you're going to be in there with the patient. If you're in there with a patient, we'll do things like cover them with a blanket while the fire department is working for things like busted glass that can fall on them. We don't want any more injuries, especially because they can get things in their eyes and things like that. Scenes of violence, yeah, assaults happen all the time. Domestic violence situations are very dangerous. Do not go in without a police officer. Suicides are dangerous. Don't go in unless a police officer says so. Hostage situations, well, yeah, absolutely. Riots, yeah, I want to get as far away from there as I can. All right, scenes of mass violence. Know who's in command. The way you're going to know who's in command, you're going to take a National Incident Management course called NIMS. You're going to have to take those courses, and the leader of the actual scene, it's called the scene command. So you're going to know who these people are. You'll report to your operations command usually. And then the scene, those people are under the scene command because they're usually in operations, and they'll tell you where to put your cot, where you need to actually park your ambulance, all that stuff. They'll give you all the information. They'll tell you which hospital you need to transport these patients to, and make sure you allow law enforcement to clear all these dangerous scenes. Okay, so any scenes involving projectiles, you shouldn't be there in the first place, but some things can happen. Find cover. So cover is things where you hide behind something. Concealment is basically going to be like you hiding. It's not going to be things that are stopping them. Covering concealment. Recommendations for preventing violence. Yeah, training, obviously. We'll go over this when we talk about violent patients, but you should know how to stand. You never square up with people. You kind of stand at an angle. You don't cross your arms, that sort of stuff. Those are sort of violent tendencies. Anytime you see the patient doing things like talking to you and balling their fist, that's usually a good indication that, some violence may take place. So you need the training and practice, really practice to de-escalate situations and know when you can be firm and then when you can actually de-escalate these situations. And then you need to improve your interpersonal communication. Being a kind person really helps you out. So dispatch will identify and alert you if any time they've had past problems in this address. Usually they'll tell you that you're going to need P on there to clear the scene before you actually go in. That happens a lot of times. Your computer-assisted dispatch will actually give you that information on services. So recommendations for protection against violence, like I said, training. They're not going to let you assault a patient. Make sure you know that. You can't just go off and hit them if you think they might hit you first. You can't do that sort of thing. what you're going to do, you can fight back so long as it's just to escape. All right, those are the escape techniques. So you're going to learn all this stuff. Usually when these violent patients start, you can even call for PD to come to your scene, and they'll help you out. A lot of times when fire departments actually respond with you, you're going to have 5 other people there with you, plus your partner, for one patient. So you can get body armor. Most people don't wear it in Oklahoma because it's so hot. It makes you incredibly hot and warm, even in the light armor for just stopping, small caliber handguns, that sort of stuff. But you should, have some sort of cross training with law enforcement or whatever department with. You'll get to know these people you work. Yeah, protective clothing is critical to personal safety. Here's some turnout gear here with the fire department. It's pants, helmet, gloves. They have their boots there too. You should be familiar with this stuff. You don't have to quite know it fully as much as the fire department does, but you should kind of know about their gear. Things like who is the white hat on scene is going to be important, which is usually the chief. He's the one we're on call. So become familiar with these things and the type of equipment they have. That way you know what kind of resources you can expect. So if it's in cold weather, layer up. Turnout gear helps with like flashover and sparks. Also, when they're cutting an ambulance, when they're cutting a car that's been involved in an accident, like I said before. Yeah, there you go. You can have gloves. You should have some sort of gloves. The Oklahoma State requires it on the ambulance that are like heavy duty work gloves, loaded gloves, things like that. You should have helmets. It doesn't have to be like a hard helmet. It could be like hard hats and things like that for accidents where you could actually get struck in the head. It's going to suggest in here steel-toed boots that you might. Those aren't necessary. I don't know of anything that's heavy enough that will drop on my foot and break it that steel-toes are going to help me with. So, but it will suggest in your book that steel-toed is. Yeah, eye protection. The reason prescription glasses aren't recommended for your eye protection is because the sides are open. So whatever glasses you get for eye protection should have some sort of side shield on them. You could actually find some that you could fit on the end of your glasses too if you want. It's up to you. Ear protection, because on scenes of accidents and things, it's loud. The fire department uses a lot of equipment to actually get these patients out of the car, which is why it's going to suggest things like ear protection. Foam earplugs are in the computer lab whenever we take our test too, in case you just want it quieter in there. It's going to suggest sunblock and things like that. Yeah, well, that's kind of obvious. Like I said, body armor, you can wear it. The kind of things that you can wear under your uniform if you so choose. So, let the patient know who you are. This is really important. So, you always tell the patient your name and you ask them theirs. For one thing, it builds trust between you and the patient because now you're not just asking them questions, you're actually giving and receiving. So let them know who you are and who's actually taking care of them. So I usually introduce myself after I ask them their name and my partner. I tell them their names as well. So you need to learn how to communicate with critical patients. All right, so you need to keep them focused on the issues that you're asking about. Don't give them grim comments like, it doesn't look like you're going to make it. You don't know that. You're not a doctor. And even they're not going to tell them that. Another thing is, don't give them good news. Don't say, you're going to be fine. Okay, because the first time that the patient doesn't turn out fine when you say that, you're not going to feel good. It's going to really mess with you. So make sure you orient the patient. Keep them focused on what needs to happen. Be honest, but that doesn't mean that you need to tell them grim and sad comments. Right? You need to learn how to deal with refusal of care patients. A lot of patients don't want to go to the hospital. Elderly men. They don't like going to the doctor. They don't like going to the hospital. And their family member called. They're like, I'll go tomorrow. Things like this. You kind of need to be firm with them and tell them what's up. For one thing, their family's not going to let them just refuse and then not nag them for the next 8 hours. So another ambulance is going to have to come and get them anyway, and then that's just extra time added that didn't need to happen. So be honest with these people about what could happen to them. All right, and you need to deal with these refusal of care. People have the option of not going to the hospital, even if you know that they're having a heart attack, and you tell them so, that they will die if they don't go. They have the right to just say they don't want to do All right, but always allow for hope. We're going to take good care of you. That sort of stuff. If there's family members there, or if a lot of times they'll want you to call their family. So take that number down that they give you. That's their family number. You can actually give it to people like the chaplaincy office that's at the hospital. You'll get to know these people owe you if you have trauma patients. Actually having families' numbers, if you can get it, is important for this so they can notify the family. All right, or you can give it to the nursing staff. So for children, it's important to actually ask a responsible adult to come with them. They can sit in the front of the ambulance because you're not going to be sitting there anyway. All right. Sometimes some places will let a small child sit in the parent's lap. We do have equipment to actually transport children in sort of car seat kind of things, but you will deal with the death of children. If it's, an infant with SIDS or a trauma accident where a child dies in a car wreck, you have to know how to deal with that kind of stuff. It's always a tragic event, because people think it's sadder for these people. They've actually done research on this because there's so much potential in children. So people tend to be sadder at the loss of a child. It's a horrible thing that people go through. Help the family in any way you can. Be prepared for them to be angry at you about this. It's not about you. They're grieving. Just understand that. So let the family's actions be your guide. Always ask if there's something you can do for them. Prepare the parents. That's important. Anytime we're talking about death, if you show up, and the child's rigid because they put them to sleep and they're not in their sleep, you'd understand we're not going to work on that patient because they already have rigor mortis sitting there for a while. So you might have to tell the actual mother or father, whoever is on scene, that the child has died. So we'll talk about that as well. So death can occur suddenly, or it can occur, over long periods because someone has cancer and something like that, and they're more prepared. It's always hard. Whether it's sudden or if it is from a long disease, it's always hard. So this is why it said earlier you need to have a certain philosophy about life and death. That's really important for you to think about for these things to happen to you, and you're just confronted. Prepare yourself mentally for this kind of stuff. So the stages of grieving is important for you to know. Now, it doesn't have to be in this order. Okay? So they can start with anger, or they can start with bargaining. Okay? So there's plenty of times when people have just screamed out when we're doing CPR on their family, take me instead. That sort of stuff. So they started with bargaining. All right. A lot of people, though, do start with denial. So it's important, if for some reason you're the person that actually has to tell them that their family member has died. Usually that's when you don't actually transport the patient because it's an obvious death. So you need to tell these people 3 times that their family member has died or their friend, whoever. And you don't use euphemisms. You don't say they're not here with us anymore. That sort of stuff. You use the terms dead, death, and have died. Right? And you tell these people 3 times because that usually snaps them out of this denial phase. But be prepared for all this stuff. Acceptance is usually the last one, right? And it takes a while, if ever. But it's your role to see how you can actually help these people, because when you're on the scene, you're not just treating a patient. You're treating that family and their loved ones as well. Okay, so, but be sure to reinforce reality. Like I said, you got to be honest with them. You have to tell them the family member has died without using euphemisms. Right? Allow them to grieve. But if there is some sort of sign that for some reason this is not a natural death, they can't go in there and move things around. Usually you're going to have to wait for a PD, a deputy to be on scene, and then they can make that sort of decision. All right, so just be prepared for that. Yeah, words are coming. It's usually, I'm sorry for your loss. I'm not going to tell people if you want to cry, it's okay. They would tend to be angry at me if I usually said that. But, you guys really cared for your grandmother. I can see how much you can miss them. It's okay to be angry. That sort of stuff. Okay? So it is a high-stress job because of all these things. Okay? So it's important to know what stresses you. if you don't know what your problems are, if you start to become irritable and things of distress, just get a check from your family. They're going to tell you that you've changed or something like that. All right, they're always the honest ones if you approach it with good intention. So, on this stress thing, there are several sorts of stages for the stress response, general adaptive syndrome. The alarm response to stress, you react to it. You might have some resistance to the stress, and then the recovery or exhaustion phase. You can learn about these by reading in the book, but make sure that you get to this recovery phase, and don't always just amp yourself up over and over again during a shift. If that sort of chronic stress reaction is going to really play havoc in your personal life, and it's not worth it. So you need to know the signs of stress in yourself and make sure you're looking out for them, and look out for them in your partners, even with your fellow EMT students here. Okay, so the physiological responses are just increased heart rate and respiration. It's all the fight or flight stuff. Your pupils become dilated, which means bigger, because you're trying to take in more light so you can see more things. All right, your skin, because there's how your blood actually works here, and your nervous system will become like cold and clammy. You'll tense up. It increases your blood sugar levels so that your body can have more energy. You're going to sweat more. You'll notice this. And then there's a decreased blood flow in your GI tract. Basically, your body is saying, I don't need to digest food right now. It's basically the point of that last one. That's just an epinephrine response that you have. So there are dangerous situations like we talked about. All right? So watch out for them. So dead and dying people. Just people that are seriously injured. You really have sympathy and empathy for these people. All right? Plus, it may be that the parents really injured in the car wreck, but the child's okay. All right? So it's going to be hard for a child to actually sit there and watch their parent die. That sort of stuff can really get to you as well. So there's going to be overpowering sight, smell, sounds. Yeah. There's going to be people screaming when they're hurt. That happens. Grown men really do cry out for their mother. It's not just something that's in the movie. One of the really stressful ones is obviously multiple patient situations, where there's going to be one-on-one ambulance involved, and there's going to be a lot of patients on scene. Like I said, there are angry people, especially if someone has died, bystanders and that sort of stuff. And then part of the fun of EMS is that, the days aren't usually generally the same, but that sort of unpredictability can bring some more stress in your life. Stress reactions are important to know. The acute stress reaction, it usually just occurs during one single stressful situation. All right. If there's a delayed stress reaction, which aren't always good, okay, usually not, it happens after the event. And like I said, if you're in a job like EMS, these stress reactions can build upon themselves and really make it hard for you. So watch out for that sort of stuff. So make sure that you and your family are watching for these symptoms yourself. All right. One of the important ones is fatigue. When you're off work, are you sleeping 18 hours a day? Because that's a big sign of depression. All right. Changes in appetite. All right. GI problems. Almost everybody in EMS, because it's shift work, will have GI problems, irritable bowel, that sort of stuff. Headaches can occur. Insomnia, which is difficulty sleeping, or when you do get to sleeping for long periods of time, which is hypersomnia here. You become really irritable and cranky. Think about people that are trying to quit smoking, how they get irritable and cranky because they're coming off nicotine, which is a stimulant. It's the same sort of thing, right? And then you can be either hyperactive or underreactive here. Okay, so you can go out and do a lot of things, or you can do nothing, and usually it's going to be that sort of bipolar thing when that happens, so you're going to have both. So watch out for things that are the psychological things too. So fear, any situations are going to be similar to things that have stressed you out before. No responsive, you're just dead. You have no emotions, depression, guilt, because you will get guilt because there's no survivor's guilt. A lot of people get that. Oversensitivity to things that people say to you. All right. You can become irritable and angry and frustrated. So watch out. These like CIS, critical incident stress. It's caused by acute stressor, which is usually what's going to happen. Mass casualty incidents where things like several cars collide. And they both had a lot of people in it. Serious injury or traumatic death of a child. Some people also get kind of tore up when it's someone their own age that dies. Crashes with injuries caused by an emergency provider, so you can cause accidents in an ambulance. You're not immune from that. All right. You can get injured while traveling to or from a call, which is why it's important to wear your seatbelt. All right. Death or serious injury of a coworker in the line of duty happens. It does happen. PTSD. Right. So it develops following a particularly stressful event. All right. What happens is you re-experience this event over and over, and you over-respond to that stimuli. And you're always recalling and thinking about this event. If that sort of thing happens, you need to go ahead and start getting help now. These CIS management, it's used to help providers relieve stress. Okay. It's usually formal. Now, what they found that happened was, they bring these trained professionals in, and what they used to do a lot of times, and maybe some places still do, is they would force people to go to all these, like, critical incident stress, like, management things, whether they wanted to or not. And then the people that didn't want to go there got worse. So if you want to talk about it, you can have one of these things, but try not to force yourself to go. All right. Unless you're going for someone else. Basically what happens is they talk about how the event actually affects them. It's not so much the event themselves. They try not to relive it. But it's about the emotions that you feel following the event. Right? And trained professionals do burnout. You'll hear about this. Exhaustion. Cynicism. All right. So EMS, whether they burn out or not, have a pretty morose sense of humor about things. But it basically, burnout reduces your performance from long-term stress. It's all this cumulative stress. You start to think worse about people, both patients and your coworkers. All right. It will affect your well-being in EMS. All right. One of the things you should do if any of these things start happening is you need to take a vacation. All right. Compassion fatigue. This is when you stop having compassion for people. All right. You think the human race is all degenerate and nobody's good anymore. So you start having less compassion for people. And what happens is you stop showing up to work, or you show up late all the time. You can't work in a team. Right? You don't have that empathy for the patient, like I said. All right. You're very judgmental and quick to anger with patients. So suicide risk for responders is high. Right, because there's so much stress on the job, right? Most people that have worked in EMS for any amount of time know of someone, or usually know someone personally that has done this, has either threatened or actually carried out suicide. So it's the largest contributing factor is all that stress. So there are organizations, you can look in your book, and you should look up these organizations, keep them in your phone, even if you don't use them. Maybe your partner or someone you know could use them. So they're really important. This is something that happens to a lot of people. All right, so the timing is important, all this stuff, and make sure you get to it early. And that way you can help people the most effectively that you want. All right, so these stressful situations can cause a lot of problems, but that doesn't mean the job's not rewarding. So there's a lot of mental health stuff that goes into it that you need to be aware of just to keep yourself where you need to be for your family, for your friends, and on the job it will improve your performance on the job. So you can have trouble overcoming personal reactions and proceeding without hesitation. It happens a lot, especially when you start the job. You're going to be frozen when you see things like it happens a lot when the first time you go on a car wreck where someone has been injected, and then they have head injuries, but they're still alive, but they've been thrown 50 feet away from the vehicle. That's one that happens a lot where people just end up like freezing on scene, which is why it's important. You might have a partner with a bit of experience in a lot of different kind of calls, and you're going to struggle to remain calm, and you're going to have an overload of information here from this fight or flight response. You're going to get tunnel vision. So you're going to get careless because you don't see things. So avoid this sort of thing that contributes to your emotional stress. All right. There are a lot of factors that influence how a patient will react. And it's a lot of things that you're not going to know about, but you need to learn how to work with people. So be professional and be courteous. That's going to be the most help. And then allow the patient to express their fear. All right. So there'll be several patients that express that they feel like they're dying. When this happens, I generally believe the patient, and I'm really hyper aware of what could happen, but I don't get too excited on these. And always respect religious customs and needs. This happens a lot. This is one of the reasons why it's a lot better to have a lot more females into the EMS system, because certain religions and cultures, they're way more comfortable with having a female treat a female, and it gives better patient care for these people. But it's a lot of things. Culture of diversity on the job is very helpful. As much diversity as you can have, because there are all sorts of kinds of patients. So even if these people are going to be different from you, they're going to help you out because they're going to teach you how to interact with all the kinds of patients that you're going to have. All right. So when you get called out for a sexual assault on a female, for instance, there's a lot of times going to be a male in the back of these people, and they're not going to trust you. So it's going to be hard to overcome that sort of stuff. But being around women, sort of asking them about these situations, what would you suggest? What can we do if we can't find a female EMT or something to actually be with these people? What do you think? Even if the EMT is female and then the male is paramedic that has to stay with the patient, it makes them feel a lot better that there's a female there on the scene. So you're going to be expected to work with a lot of different kinds of people, different beliefs, different values. It's really rewarding when this sort of thing happens, especially because it reflects the sort of society we're in. So if you work in Oklahoma City, for instance, you're not just going to find people that speak English or speak Spanish. There's going to be a lot of people that speak things like Vietnamese that you haven't been around. You don't know the culture. Working with those kind of people can help you. So be sure to communicate in a way that's sensitive to other people's and other cultures. Learn about these things. It really helps you remain open-minded and curious to this stuff. So you're sensitive to their needs. Sexual harassment's in here. You have videos on this. We should go over quick pro quo stuff, which means one thing in exchange for another. Hostile work environments can be all over. So watch out what you say, even if you don't think other people are around. All right, you need to have the right mindset when you work to be a professional. Report any harassment to your supervisor or your HR department or both. All right, and make sure that you keep your notes. Substance abuse is more common than it should be in EMS. Well, we are usually people that keep narcotics on the ambulance. And then if those go missing, the DEA, the Drug Enforcement Agency, starts to ask questions. Okay? But beyond that, it's going to influence patient care. You're not going to get good care. Okay? Because people will do things like say they're giving a narcotic to the patient, but really just give them things like saline and keep the narcotics for themselves. That's bad patient care, and it comes from addiction, which is a big problem. It's a big problem for anybody that's addicted. They act in ways they wouldn't normally act. All right? It leads to poor decision making. Okay? Seek help. If they catch you doing this, or you use illegal drugs, or prescription drugs that you're not prescribed, or you have a problem with prescription drugs, your medical license is going to be affected by this. All right? The state's going to take that away from you. So always seek help. All right. Discuss it with management about confronting people that you think may have a problem. And there are employee assistance programs available. There have been people that have gone through these programs and still have a job. So don't worry about your job when you have an addiction like this or your partner has an addiction. They need the work. It's going to be far more helpful in the long run that they get help for this stuff. Yeah, injury, like I said, there are a lot of knees that have problems. Shoulders go out. Back injuries is one of the big reasons why people leave the profession, at least when I first started. There are other things now. But that sort of thing happens, so and when you actually are around a real ambulance, if you go through the side door, usually there's a little step that comes down. That can actually help you in the long run save your knees, save your back. Learn how to actually lift patients so you're not bending over at your back. You're keeping your back straight, you're lifting with your legs. That sort of stuff. All right. Whatever, like, prevention program, ambulance services should have these. Like, it should be led by management, but make sure that you're participating in it. And just because you're young and you don't feel it, these sort of things have a cumulative effect over several years. And then it's going to be a situation where you're always having back problems. And if you're not having back pain that day, it's probably that there's something wrong with your nerves. So try not to have back problems and that sort of stuff, knee problems, shoulder problems. All right. So make sure there's hazard prevention and control programs that you'll work. Any education and training, they're going to teach you this stuff too. And there is, like I said, Chapter 8 is going to be this lifting issues. And then they should evaluate these programs and make sure that it's working. Okay, so the review at the end here. So, a disease that can be spread from person to person. All right, so this is one of those questions where it's going to have a distractor in there, where it seems like there's an answer that should be correct, which is A, infectious disease. So if you actually read these questions and when you're taking your test, make sure that you're looking at all the answers and reading the question and the answer thoroughly for distractors like this, because you may think that it's infectious disease, but if you don't read the other answers, you won't find out that the answer is B, communicable disease. All right, this is just a question that's testing knowledge. Yeah, which is why you'll notice on this rationale, there's a longer explanation for why A is wrong than why the other ones are wrong. That's because that's what's called a distractor of the question here. So be sure to read all your answers. Read the question carefully. All right. The most effective way of preventing the spread of disease. So a lot of times when you have these questions, they're going to actually all caps important keywords, most or least, those sorts of things. So if you actually look at these and read all answers, I said it in the lecture, so there's also a question here about it. Yeah, it's hand washing. All right, so while you care for a trauma patient, the EMT has blood splashed in her eyes. This is an example. Okay, so there are several things that are actually similar in the answers here when you read them. So you probably don't think it's infection, but if you read the other answers, is it an exposure? Or is this indirect contact? Okay, or is this just disease transmission? So this is one of the things where it really pays that you actually learn your definitions in the chapter. And there's always like definitions at the end of the chapter that actually explains this stuff. But if you actually read them all, it's exposure. So you should know that it's when a person comes in contact, it's either direct or indirect. It's both of those are exposures, which is why indirect isn't correct on the answers here. Yeah, what's important, by the way, it's transmission. This is the way the infectious agent is spread. All right, and it's all the different sorts of contacts and point transmission and stuff. But the actual definition answer here is the exposure. All right. The protective measures that prevent healthcare workers from coming into contact with germs. Germs isn't so much a medical term here; it's a catch-all phrase for things like bacteria and viruses, typically in the public. But what are those measures that actually protect you from germs? So if you read all the answers here, the two that should stand out to you are B, standard precautions, and then D, PPE. Now, the thing is, standard precautions contain PPE, but it's also things like making sure you wash your hands before and after you have the patient and clean your equipment and stuff. And that's why the most correct answer is actually B. Yeah, so B here, it's the equipment to shield the worker, but it's not the measures that are put in place. Okay, here's one you're just going to have to know as you read through the book, the second stage of the stress response. Okay, what is that? So, if you read these and kind of put them in order, think about it that way. If you put them in order, it probably starts with the alarm phase. Then what would be next? I would think like reaction resistance, and probably recovery is after the reaction and resistance, and then exhaustion's at the end. So the answer is D. If you just take these and try and order them in your mind as they're listed, the answer becomes a little clearer. Yeah. So exhaustion is the third state. Recovery is prolonged. Then the exhaustion occurs, so that's at the end. The recovery is the third stage, and then the first stage is just the alarm, like I said. So just try and reason out these answers, even if you don't actually know the correct answer, and it can kind of help you. So you have to think about these things. So condition characterized by re-experiencing an event and over-responding to that stimuli that recall the event. So several key words in here. So re-experiencing, recalling. Which one of these answers do you think actually goes with that? B. That's when you re-experience that event, that's PTSD. So the other answer is, it's important to actually put those in context. So the acute reaction, acute is going to be during the event. Delayed is after the event. All right. And then the cumulative stress, it's all the events added up. But if it's an event from the question, one event, that's going to be PTSD. All right. What's the fuel for the body? Yeah, it's food. That one's kind of easy. I don't know what else it could be. Yeah, so sleep cycle will improve your concentration, certainly because you're not sleepy. Yeah. Exercise will increase your strength and endurance, but food's the correct answer. Work-life balance is awesome, but it doesn't make much sense to that as your answer. All right, so which stage of grieving commonly results in blame? If you're angry at someone, you typically blame them. So we can look at it here. Yeah, the person may lash out at the EMT for the unfortunate event, so it is anger. Just refusal to accept the situation, especially if it's things like death of a child or death of a loved one. They're really going to be in denial on those situations. Bargaining is trying to exchange things to get what you want. Depression, they're usually silent, so the answer is B. All right, placards are used on. This has to do with hazmat, and we'll go over this later on in the book. But placards are in two basic places. All right, the most common that you're going to see them are going to be things on tractor trailers. They're going to have those placards that use the orange book for. All right, the other places you're going to see them are inside hospitals, or if you're actually in an industrial area in those sorts of buildings. So the placards aren't on individual packages. The placards are on basically the storage areas and places, but not storage lockers. All right, they're not going to be in the individual lockers. They'll be on the door before you enter the place at all. All right, and the storage papers are usually the material safety data sheets, and those are kept with the chemicals. But before you enter the actual building or the room that all this stuff is kept in, you're going to find some placards. That's A. All right, find most common hazards associated with the structure of fire. All right, so if we actually look at these answers, all right, if you read them, and I'll tell you an easy way to tell. If you look at these, both A, B, and C have smoke to start with. So I would automatically assume, unless there is something that is blatantly obvious that there's no reason smoke should be there, that it's not going to be D. Okay, just because all the other ones have it with it. So you have to go on to the other sort of things that are listed there. So two of the three, A, B, and C, have oxygen deficiency. All right, so the difference here is going to be what's after those. So two of those are very similar. So I would think there's probably a high incident that it's going to be either A or B when I'm looking at these kind of questions. All right, so but let's look at C and see why it's not the correct answer. Okay, so structural fires. I'm typically not worried about electrical shock. A lot of things, times the electrical system shorts out long before that. But there are toxic gases and high temperatures, and then inhalation of tar products. All right, so now we can look at A and B. Now, if you look at B, it actually has inhalation of tar products as well, the same as C. All right, but C didn't have oxygen deficiency. Okay, injury from breaking glass. I'm typically not concerned with that when a house is on fire, that maybe I'll get some cuts, right? But building collapse happens all the time. So now let's look at A. So oxygen deficiency, yeah. Fires usually sort of eat up the oxygen for their chemical reactions. High temperatures, yeah, it's fire. Toxic gases, like I said, when things like plastic or insulation burns, that sort of stuff, toxic gases, a lot of them. The one we're most worried about is cyanide occurs. All right, and then building collapse. Okay, so the differences between A and B are going to be tar products and then breaking glass. I'm going to say that there's not a whole lot of tar products like on their own in buildings. You're going to have some, okay, from things like shingles, but there's also going to be a lot of carbon for the burning because burning causes carbon to actually be released from organic compounds. So I'm going to say that A is going to be the one that's going to be most correct. Let's see, yeah, it's A. Yeah, the 5 hazards most commonly associated: smoke, oxygen deficiency, high ambient temperatures, toxic gases, building collapse. All right. So smoke is made of particles of both tar and carbon, which is my B is incorrect. Now C is the same reason. It's made up of both tar and carbon. Now I'm not so worried about electrical shock in most fires. All right. But it does have tar products as well. And then D, like I said, smoke is missing. So you can almost throw those out. I would still read through it and make sure that there's a reason that it's incorrect.